When the body gets into heat exhaustion, the body's getting an increased temperature. It's starting to put stress on your internal organs, the heart, the kidneys, as well as is typically accompanied by dehydration. And so it's really that early stages of the body starting to overheat, and people start to experience that by some fatigue, as in the name, the exhaustion that comes with the heat exhaustion, inability to tolerate exercise outside. It's all dependent on the individual person. So it doesn't necessarily have to be all that hot. Particularly people that aren't used to being out in the heat are the ones that are at higher risk for being out in the heat. So someone that normally stays in an air-conditioned environment, goes out on the weekend and starts working in their garden when it's over 100 degrees is going to be at more risk than somebody that works out in the heat every day and has been used to it. The higher the humidity, the higher the risk of heat exhaustion, because our internal mechanisms like sweating to help cool us down don't work as well when the humidity's high. The point at which someone transitions over into heat stroke is really the point at which we see their mental status become impaired. So it's not necessarily a defined temperature, it's more that point at which they start to either not act right, they pass out or lose consciousness, they show signs of confusion. Those are the things we worry about, that now that person's crossed over from heat exhaustion to heat stroke. Once you cross over into heat stroke, if it's allowed to go on and be prolonged, you could suffer brain damage, damage to the kidneys especially. The heart is also put at extra taxing from the elevated temperature and the elevated work that it's having to do. And if left completely untreated, it can result in death. So when someone's suffering from heat stroke, the heart is having to work extra hard. So anyone that has underlying heart problems is even at more increased risk, because now we're putting all sorts of extra strain on the heart from having to pump more blood through the body and also deal with the dehydration that comes along with heat stroke. When the kidneys get affected, much because of the dehydration that also occurs with it. So someone can be at risk for developing acute kidney injury. Someone that also has underlying kidney dysfunction is at worst for even worsening of their kidney dysfunction if their body is allowed to stay in that state of being in heat exhaustion or heat stroke. With lungs in the heat, you're having to breathe extra fast to make up for that increased metabolic demand on the body. When the brain crosses over into that point of heat stroke, that's the point at which we're worried that there could start to become brain damage. So we need to get that patient cooled down as quickly as possible to avoid any lasting sort of brain damage. The increased heat causes problems with the metabolic problems as well as the circuitry of the brain that can ultimately result in permanent brain damage, unfortunately.
And just to cover all our bases, we've gone with the other ones. Anything heat?
With the muscles, you end up getting muscle cramps because as you're sweating, you're losing electrolytes, you're becoming dehydrated, so certainly you can start to develop muscle cramps along with that heat exhaustion. When we come on scene with EMS and we recognize, especially when someone is in heat stroke, the safest thing to do is to start cooling that patient down right there on the scene. So we use something called cold water immersion, where we're basically going to use a bag to put around the patient and keep circulating water through it to bring their temperature down until we get it down to about 102 degrees. That's the point at which it would be safe for us to then bring them to the hospital. But the most important thing to do is we've got to get them cooled down as quickly as we possibly can. So if someone's feeling heat exhaustion, but they haven't crossed over into that altered mental status of heat stroke yet, first thing is need to get out of the hot environment if at all possible. Need to start drinking fluids and taking those in to get cooled down. If someone is to the point that they are vomiting, they really need to come to the emergency department because we're worried that they're not going to be able to stay hydrated at that point. The heat has definitely been shown to affect people's mood and make them feel a little bit grumpier. Similar to the extreme cold also shows to make people feel grumpier. Really, the time that's the most dangerous is the time when the temperature's the hottest and the humidity's the highest. Whatever time of day that happens to be, that's the time to stay out of the heat, if at all possible. Our team in the emergency department right now is really focused on recognizing those folks that are coming in with heat exhaustion, getting them cooled down before they end up all the way to heat stroke. And if somebody comes in with signs of heat stroke, we're going to be working on them right away to get them cooled down as quick as we can. We are certainly seeing people on pretty much a daily basis right now that are having heat-related illness. Over the next few days, I would expect our heat-related illness numbers to go up, just given the heat and the humidity that we're going to be dealing with, these high temperatures coming. So when someone comes in for heat stroke, the first thing we're going to do is get them in as cool an environment as possible. If at all possible, we are going to find a way to use what we call cold water immersion, where actually we put them in cold water, obviously keeping their head and everything out safely, but we're going to put them in cold water. That's the most efficient way that we can cool them down, as well as start to give them IV fluids to get them rehydrated. We need to watch out for our young athletes that are outside playing soccer tournaments, softball tournaments, baseball tournaments this time of year, making sure that parents have plenty of fluids for them to be taking in during the game. Watching out for those kids that are getting overheated to get them off the field and out, and using whatever measures, whether it's fans, cold towels, whatever you can to keep those athletes cool out in these hot temperatures. Signs of heat exhaustion to watch out for are starting to get things like dehydrated, muscle cramps, feeling nauseous, headache can be signs of heat exhaustion, and just a general inability to tolerate the activity that you've been doing out in the heat.